Wait, my God, let the screen come to this part. Please start.
Good morning to one and all present here. We have gathered here for the fourth and final day of the workshop, COVID Epignosis Fight the Infodemic. On behalf of Promethean's MBBS batch of 2018 and Father Muller Medical College Alumni Association, I would like to welcome the management, HODs, staff, students, and everyone present here today. In today's social media driven world, so much information is easily accessible with no background check of its veracity being carried out. This workshop was ideated with the objective of debunking the misinformation making the rounds about the ongoing pandemic. To this end, we have already been witness to past 3 sessions that covered a host of topics. Today, we have 2 speakers amongst us. Professor Cherishma de Silva, who will give us insights into the role of physiotherapy in the management of COVID-19, and Dr. Smitha Raskina, who will talk about mental health issues faced by doctors, nurses, patients, relatives, and students during the pandemic. Please note, we're streaming live on YouTube, and the link is put up in the chat box. Kindly share it with your friends and family. You can put your questions during the session to the host or any of the co-hosts. Do not put your questions to the speakers as they won't be seeing it. Also, please wait till the end of the session for the attendance link. We will not be sending the link once the session is over. If you face any technical issues at the time the link is being sent, contact Melisha, Aaron, or Raghav, and they will help you out with the attendance link at that time. Jeffrey will now introduce our first speaker. Over to you, Jeffrey.
Thank you, Manasa. So without further ado, let's get into today's program. So the first speaker for today is Miss Cherishma de Silva. Miss Cherishma de Silva is a professor in BPT, and she did a bachelor's in physiotherapy in Father Muller Medical College and her master's in Kasturba Medical College, specializing in cardiopulmonary sciences and critical care management. She is a member of the European Respiratory Society and Multinational Association of Supportive Care in Cancer. She has published many papers in national and international journals and also presented papers and delivered lectures in the international and national platforms. She is presently working on funded research projects. Ma'am, we are glad to have you here today. The stage is all yours.
A very good morning to each and every one of you gathered here. Am I audible enough?
Yes, ma'am.
Yes, thank you so much. And first and foremost, I would like to congratulate batch 2018 for this amazing sessions on COVID-19. Definitely, it's a need of the hour right now, and also the Alumni Association for what y'all are doing. And you're doing a great job, students, and all the very best. As it's the last day, you've come to the last day. I'm sure you'll put up a great show again. Okay, coming to today's talk, I'll be speaking about role of physiotherapy in COVID-19. So my contents for today's talk will be, I'll be dealing with basically basics of physiotherapy here, definition of what physiotherapy is, what is rehabilitation, what is the need for physiotherapy in COVID-19, screening guidelines for physiotherapy reference, clinical classification of COVID based on which physiotherapy care will be given, precautions needed to be taken, what is tele rehabilitation, the new trend which is very upcoming these days, physiotherapy care in hospital which involves critical care physiotherapy as well as physiotherapy in wards for COVID-19 patients, and post-COVID rehabilitation. My learning objectives for today will be, I want you all to know, students, at the end of the session, what is physiotherapy and what are its implications on COVID-19, what are the standard physiotherapy reference guidelines that needs to be followed, and indications for physiotherapy as per the clinical staging, various modes of physiotherapy delivery, various physiotherapy treatment techniques that are available, best practice of physiotherapy in COVID, and need and effectiveness of post-COVID rehabilitation. So now coming to the first question, I would like to ask you all what according to you all physiotherapy is. You can type in the chat box. What do you think about physiotherapy? We have a physiotherapy department, which is, we have a separate OPD and IPD department at Father Muller's. You've seen it. So what according to you all physiotherapy is? Any idea? Something. I'm sure few of you all must have taken physiotherapy treatment. Okay. Nobody knows what physiotherapy is? Okay, let me tell you all. It's a healthcare profession that is concerned with human function and movement to maximize the physical potential of an individual. We all are humans, right? We are tend to move. Humans are basically meant to move. God has created so that we move. Only when we move, we try to attain whatever we want to achieve in life. Only when we move, we can go to work. Only once we move, we can study. So it's all about movement and function in a human body. So physiotherapists deal with it. Okay, we deal with human function and movement, maximizing the physical potential. So basically what we do is we identify whatever the problems related to human function, movement, and different physical components, and we try to enhance the quality of life of the patient and movement potential within the spheres of promotion, prevention, intervention, and rehabilitation. Okay, this is what the physical therapist does. We deal with maximizing human function, movement, and maximizing physical potential, thereby improving a quality of life of an individual. Now, what is rehabilitation? The term rehabilitation sounds very luxury. It's like only few certain a group of people can get rehabilitation. That's what we think. Okay, but rehabilitation is nothing but it's a set of interventions that is designed to optimize functioning again. Movement is important. Once we are humans, we need to function to a maximum potential and also reduce disability. We all know how bad having a disability is. Okay, it's really difficult to function when we are disabled. So rehabilitation deals with reducing disability in individuals with health conditions in interaction with their environment. Now coming to different aspects of physiotherapy. If you come to OPD, you would have seen big boards where it is written like musculoskeletal physiotherapy, neurophysiotherapy, pediatric physiotherapy, community-based physiotherapy. So these are the different branches of physiotherapy that deals with different things. Whereas cardiorespiratory physiotherapy is one of the branch of physiotherapy where we deal with acute and chronic respiratory and cardiac condition. And our main aim here is to improve physical recovery from an acute illness. So the first question goes like this. Do COVID patients require physiotherapy? What do you all think? Do COVID patients require physiotherapy? Yes or no? That's why I'm taking the, okay, I'm getting, many of you are telling yes, yes. Okay, so let's see what happens to COVID patients. Yes, the COVID patients definitely require physiotherapy. Now, why? Why do they require physiotherapy? What is the need for physiotherapy here? Because of the impairments that they face with. Okay, we know most of the COVID-19 patients end up having ARDS. Okay, that is where they end up. So the major complications, the impairments, what we see here is ventilation perfusion mismatch, hypoxia, reduced gaseous exchange, prolonged ventilation, sedation, neuromuscular blocking agents that have been given, and patients are mechanically ventilated many days in ICU, thereby causing ICU acquired weakness. Again, here you see the function, the physical function is being affected. Okay, so these are the needs, these are the impairments why physiotherapy has to be given. So I'll explain to you all as we deal with the management part, how we are reversing each of these impairments. Now, coming to screening guidelines for physiotherapy reference, as we know, COVID-19 is a pandemic and it is highly contagious. So it doesn't make sense just because there's a COVID patient, it doesn't mean that you have to refer each and every COVID patient to physiotherapy. Okay, there are certain guidelines that needs to be followed. If your patient is having only mild symptoms without respiratory compromise and the cough is non-productive and SpO2 patient is maintaining more than 90%, okay, patient is independent and he is able to clear secretions, no physiotherapy intervention is required here. Okay, no physiotherapy contact is required for the patient. Again, mild symptoms with pneumonia. Patient is presenting with pneumonia, but the patient is already having a coexisting respiratory condition. He had already had an underlying COPD or an asthma, okay, and along with neuromuscular conditions, okay, comorbidities, if he has it, then physiotherapy reference can be given. Okay, but here strict airborne precautions has to be maintained by the staff. And if the patient is not on ventilator, see, ventilator is a closed circuit, so there is less chances of airborne infection. But if the patient is not on ventilator, the guideline says the patient is asked to wear their surgical face mask. I personally don't agree with this. Unless and until you're only mobilizing the patient's fine, you can make the patient wear a face mask. But when you're giving breathing exercises, the face mask needs to be removed. So you cannot help here. Severe symptoms, again, yes, if the patient is having consistent with consolidation, severe secretions are there and the patient is unable to remove the secretions, yes, you give physiotherapy references. And also in ICU, if the patient is in ICU, give the reference for early optimization, especially for early mobilization. And significant severe symptoms now with significant functional limitations, okay, patients are having, which is impacting their independence. I told you all in the beginning, humans are meant to move. We need to be independent, okay. Supposedly your functional independence is being affected, thereby affecting your mobilization, exercise, rehabilitation, and ICU patients. Definitely physiotherapy reference is required. Use droplet precautions, use airborne precautions, as also if patient is not ventilated, patient is asked to wear surgical masks. So these are the referral guidelines when physiotherapy needs to be actually referred in COVID-19. Now moving on to clinical classification, okay, as per the clinical classification and suggested physiotherapy care that needs to be given. Okay, if at all, if there is mild symptoms and oxygen saturation is about, SpO2 is 90 to 90% and no symptoms are there, D-dimer shows less than 1, HRCT is less than 8 on low flow oxygen support, the patient you can give diaphragmatic breathing exercises as well as incentives parameter techniques can be given here. And next, if the patient is showing moderate symptoms, okay, and if your HRCT score is between 9 to 14, D-dimer is more than the normal one, then you're indicated for airway clearance techniques, diaphragmatic breathing exercises, early mobilization with monitoring is very, very important. Now, severe symptoms, that is, patient is on a mechanical ventilator and your HRCT is more than 15, the score is more than 15. Here comes pruning, airway suctioning, airway clearance techniques, and early mobilization. And patients are very critical, okay? Patients have already developed ARDS with multi-organ failure, sepsis, shock, and patient is on a high flow oxygen support, that is on mechanical ventilator, then airway care is important and early mobilization is very, very important here. Now you need to remember one thing, COVID-19 poses significant consideration for respiratory physiotherapy interventions due to their aerosol generating procedures. Okay, and in the last week, if you remember, Dr. Veena speaking, she spoke very nicely about this aerosol generating thing. She told that when COVID-19 patient coughs, the aerosol is being generated, it can travel up to a distance of 2 meters, and once it is generated, it can remain in the air for a longer period of time. Okay, so physiotherapists, most of our techniques, all the physiotherapy techniques are aerosol generating procedure. So here there comes something called as a risk versus benefit that we need to consider. When we make a patient cough, we say secretion clearance, patient is finding difficulty in coughing. You have to make a patient cough. Obviously, you're generating aerosols. In order to loosen the secretion, you tend to give nebulization or humidification. Again, high chances of aerosol. Our techniques like postural drainage, percussions, and vibrations. I'm sure you all have seen us performing percussion. Sometimes when you enter ICU or in the ward, you can hear somebody clapping the patient's chest. Okay, that technique is called as a percussion, and it is basically given in order to loosen the secretions. And even techniques like manual hyperinflation and positive pressure airway devices, everything, okay, is all aerosol generating procedures. So points to remember before physiotherapy application: always weigh risk versus benefit. What is the risk and how much is the benefit? If you feel that by taking this particular risk, if your patient is getting benefited, yes, why not? You have to go along with it. Okay, it is strongly recommended that airborne precautions are utilized during respiratory physiotherapy interventions. A strict airborne precautions has to be maintained. Physiotherapy techniques are high risk because of aerosol and micro droplet generations. Reduce exposure to COVID-19 patients is ideal. Okay, if you see, it prevents infection, and also only when we have seen the reference system now. Okay, we know when the patient has to be referred for physiotherapy. Instead of irrational wasting of PPE doesn't make sense. Okay, we need to be cautious. So follow the strict referral guidelines. Only when it is required you refer, and only when it is needed we weigh the risk versus benefit and deliver physiotherapy techniques. Now, as for the WHO as well as the WCPT, they prefer, okay, they suggest that there should be availability of isolated rooms in order to take care of this droplet precautions, as well as negative pressure rooms are a must. Okay, when we have this, then you are at safe. Because see, what happens is we physiotherapists, we come to ICU, we give all these breathing exercises, we give all these techniques, and we generate aerosol, and we just leave the place and go. But we need to think about what about the nurses that are working in the place. Okay, even your doctors, you keep coming and going. So all these things needs to be taken care. So especially as a precautionary measure, every individual that enters ICU, we need to wear strict PPE, strict droplet precaution has to be maintained by each and every one of us, including the nurses, the doctors, everyone who's entering the ICU, because of all these issues. Okay, now the most upcoming, okay, rehabilitation, keeping all these things in mind. Okay, tele rehabilitation is something that is very, very upcoming, and research is being done in this area, and they say that tele rehabilitation is feasible and effective in treating COVID-19 patients when you don't have enough of all the required strategies in order to prevent a droplet infection. You can go for this, but provided for this your patient needs to be conscious, oriented, patient needs to follow all your commands, and patient should be very, very cooperative. Only then you can give tele-rehabilitation. Here you can see a picture where I'm giving tele-rehabilitation to one of our patients in Father Muller's. We are having this tele-rehabilitation setting as well. But not only this is given only for patients who are cooperative and who belong to the first category of classification, where I told you all mild symptoms where they just require some diaphragmatic breathing exercises and center spirometry can be given with the help of tele-rehabilitation. Otherwise, we do go to ICUs and wards to see our patients. Now, coming to other part of rehabilitation, rehabilitation begins in the ICU, in the critical care setting, as well as in the wards. Now, ICU, when the rehabilitation as ICU is indicated, strictly you need to follow these guidelines. Only then you can touch a patient. That is, first is approval from the intensivist and his team. Okay, the intensivist should give you an approval, and stable vitals are very, very important, which as follows. Breathing frequency should be less than 24 breaths per minute. Resting heart rate less than 50% of predicted maximal heart rate. Maximal heart rate is calculated with the formula 220 minus H. So that gives you a maximal heart rate. So your resting heart rate should be less than 50% predicted of that. Blood pressure should be less than 20% of variability when recently which has been taken. And PaO2, FiO2 should be more than 300. SpO2 should be more than 90% with a recent decrease of only less than 4%. Okay, only then it is accepted. If not, you cannot touch this patient. A stable level of consciousness of an individual is important. Normal ECG with no evidence of MI or arrhythmias. Only when you find all these indications, when your patient is fine, only then you can give physiotherapy to such a patient in the critical care setup. Whereas I told you all initially, the impairments are ventilation perfusion mismatch, decreased gaseous exchange, and hypoxia. Now, early mobilization stands up to be the best practice in critical care. Okay, so early mobilization is we tend to mobilize the patient. We move the patient's arms, legs, and we move the patient out of the bed as early as possible in the ICU. This can start within the first 2 to 5 days of critical illness. That is, in the first 48 hours, you can start giving early mobilization. And this is one of the things that we are practicing even in our COVID ICU too. We are mobilizing every patient in the ICU, even if they are mechanically ventilated. Okay, so this is the best practice because everyone know that humans, our lung have 3 zones: zone 1, zone 2, and zone 3. Zone 1 majorly for ventilation, zone 2 where ventilation and perfusion both takes place, and zone 3 is for only majorly perfusion takes place. Okay, this is in simple terms. So now, considering patients in ICU are usually most of the time supine. Supine is considered to be the worst position for any patient. Okay, because here the ventilation and perfusion mismatch happens. Amount of air entering the lung is completely decreased. The zones, it's completely decreased, thereby putting the patient high risk of lower lobe atelectasis is a high chance here. So you, as soon as possible, you need to mobilize the patient. You need to do at least bed mobility activities, give them range of motion exercises, make the patient sit when they are conscious, GCS is stable. Again, follow the rules, that is follow the vitals, what I just said earlier. Standing, you can give standing, you can give transfers, free gait exercises, and ambulation. I would like to say that even ventilated patients, this is pre-COVID, okay? Ventilated patients with COPD and with GPS, we have mobilized even with a mechanical ventilator. With the tracheostomy, we do mobilize in the ICU when the patient is pretty stable. So we can follow this early mobilization techniques in the ICU. It is suggested to limit or prevent physical and cognitive dysfunction in an individual. Now, another best practice that we all know, we all hear about is proning. Okay, proning is something that we need to do all the time. That is, awake proning position is something that has to be followed by all the COVID patients because it limits the lung collapse by making the dorsal segments of the alveoli available for gaseous exchange. Again, when you put proning, you're reversing hypoxia. You're improving gaseous exchange. That was your impairment earlier. Okay, because you know the dorsal lung fields are much bigger. Okay, you are limiting the compression of the dorsal alveoli when you are putting the patient into proning, thereby enhancing the gaseous exchange. Now, what are the indications for awake proning? First is quick relief from dyspnea. Proning is considered to be a quick fix until the condition is stabilized. Even for patient who is who's just diagnosed with COVID, and you know that the patient can get a little bad, always suggest them, ask them to go for proning. It's considered to be one of the quick fix. Okay, and there are 2 types of awake proning for different situations, which I'll be talking to you all now. One is called as a short-term awake proning and the long-term awake proning. Now, what is a short-term awake proning? So the time of proning spans is only for 3 hours to 8 hours, and it is given for patients with mild to moderate hypoxemia, helps in airway drainage, and improves refractory maneuvers in relation to atelectasis. Lower lobe atelectasis is effectively treated with this technique, and when given short-term proning, it was observed that there was improvement in respiratory rate and decreased crackles during each breathing cycle. Now, what about long-term awake proning? Short-term awake proning, I told you all, the proning spans is only 3 to 8 hours, whereas in long-term, it is more than 8 hours. For severe hypoxemia, you suggest this long-term proning, and for severe ARDS patients, especially it happens whenever there's a steep decline in blood oxygenation, okay, and severe dyspnea. It is the last stage of the development of COVID-19 infection. So that is the time you are supposed to give long-term awake proning. So these are the two different types of proning techniques which can be followed. The first picture what you all see is called as prone abdomen free, and the next one is called as the abdomen restricted. In prone abdomen free, you see that there's no pillows under the abdomen, so abdomen area is free. Okay, and here one pillow needs to be kept under the patient's ankles, one under the pelvis, and another under the patient's head and the upper thorax. Whereas in abdomen restricted, only one pillow has to be kept. Abdomen free position is something which is usually practiced, and it is known to be very comfortable to all the patients. And now this is how awake proning and repositioning has to be done. Here the first thing is patient needs to be conscious, he needs to be oriented in order to do this. So first 30 minutes, okay, you ask the patient, or to 2 hours, you can ask the patient to lie prone, and next ask the patient to move into right lateral recumbent position as you see in this picture. This is again for 30 minutes to 2 hours on what you choose. You want the patient to be on short-term proning or long-term proning, and then sit up. As I told you, upright is the best position because this is where the maximum ventilation takes place. That is why we are all standing, sitting, and running most of the time. That's the best position for all of us to be awake and moving. And then after sitting for 30 minutes to 2 hours, again ask the patient to go for left lateral recumbent position, then back to prone position on the belly. On the belly, it can be abdomen free or abdomen restricted. Now, what are the contraindications for proning? Everybody says proning, so it doesn't mean that every patient is indicated for proning. Okay, we need to be very careful when we advise proning. That is history of spinal instability and spondylolisthesis, scoliosis, injury, or trauma to the spine. You're not supposed to give advice proning. If the patient is having raised intracranial pressure, no proning. Pregnancy, no. Hemodynamically unstable conditions like hypertension and cardiopulmonary diseases, no proning. And abdominal open wounds or even open wounds in the thorax, okay, even in your leg, upper thigh area, you're not supposed to get proning. These are the specific contraindications. Now coming to the complications, what are the complications for proning? One is decrease in provision of enteral nutrition. Okay, it is difficult, especially this complication arises when you're not doing awake proning. Instead, when you're doing proning to a completely sedated patient. Okay, it's difficult to provide enteral nutrition. Chest tube dislodgement is one of the major complications that you see. Increase in intra-abdominal pressure because of the gravity. Your abdomen, the intra-abdominal organs tend to move downwards and the thoracic content tend to move forwards, thereby causing an increase in intra-abdominal pressure. Okay, and whenever an ECG keeps monitoring difficulty because leads can be displaced, the ECG leads can be displaced, and continuous proning on one side can lead to facial edema and pressure trauma on the nasal bridge of the patient, the mentum, the humeral head, knees, and male genitals. Pressure trauma can be present, and also increase in intracranial pressure is being noted. So these are some of the complications we need to be very, very careful of. So that is one of the reasons where a few ICUs do have a protocol. Even before putting the patient into proning, they tend to take, keeping all these complications in mind, they tend to take the permission from the patient bystander or patient party has to give their willingness in order to put the patient for proning position. Now we spoke so much about proning. We know proning is good, so you all must be thinking, why not sleep proning? Let me just sleep prone, and that is it. That's it. We can ask all the RDS patients to sleep prone. That's the best thing to do. But there are problems with sleep proning. Why? Because this extended period of proning, lying on the sleep, can cause pain in the back, neck, and lower lip area. And it causes spinal instability because the spine will not be able to position itself accurately, thereby causing the nerves that exist the spinal segment to impinge, causing pain in the area where that particular nerve supplies. And rare cases can also cause airway obstructions, leading to obstructive sleep apnea if the patient is prone for that. And also in ARDS, it is very important to position the patient prone only while the patient is conscious, but not while the patient is in a sleep position. Okay, When the patient is going to sleep, it's always better to position the patient in neutral position. Now, initially, I also spoke this. These are the two best practices in ICU. Now, when we speak about proning, long proning and short proning, I personally feel, okay, this is what even the guideline says. It's not only a job of a physiotherapist, whereas it's complete proning is a complete responsibility of the entire medical care team. Okay, it's together with physiotherapists, nurses, and doctors. We need to put patients for proning, especially when it comes for long-term proning, where the patient requires proning for continuous 8 hours and more. Okay, short-term proning, yes, we can do. We are doing for all our patients, even in the wards. We are giving them proning, short-term proning positions, and when they are, especially when they are awake and they are active, short-term proning is being done. But long-term proning, based on the indications, can be mentioned where there is severe hypoxia. Now, coming to different types of physiotherapy management that is available for airway clearance. These are the available techniques that are present for airway clearance. We do have positioning, a technique called as ACBT, that is active cycle breathing technique, manual hyperinflation, percussions and vibration, positive expiratory pressure device, mechanical insufflation, exsufflations, and post-expiratory techniques. So this, I'm just not going to deal with each and everything in detail because these are itself a major topic. So these are few of the techniques. Here you can see these two instruments, and green and blue is called as the acapella. It's a positive expiratory pressure device which helps to remove the secretions. And on the other hand, you can see another positive expiratory pressure device, a PEP device, and manual hyperinflation can be used as a life-saving manual. Along with it has three techniques like slow deep inspiration, inspiratory hold, and quick release. It mimics an effective cough. So we physiotherapists use it in order to mimic an effective cough in tracheostomy as well as in endotracheal patients. And this is another device called as a flutter, which can be used for airway clearance techniques. Now coming to post-COVID-19 pulmonary rehabilitation. Okay. What is pulmonary rehabilitation now? We all know that pulmonary rehabilitation is available. What is it? Pulmonary rehabilitation is a multidisciplinary approach. It's not only belonging to a physiotherapist. It is here a pulmonologist, a nurse, a social worker, a speech language pathologist, and also an occupational therapist. Okay, each and every one of us play an important role. A psychologist mainly, okay, plays a very important role dealing with pulmonary rehabilitation. It's a multidisciplinary and a long-term program based on targeted exercise and education for patients with chronic respiratory illness. Now, COVID-19 poses that pulmonary rehabilitation is very much essential in all post-COVID patients. Okay, pulmonary rehabilitation has a positive effect in improving the health-related quality of life, mortality, exercise tolerance, and decreased exacerbations. It is aimed at improving physical, mental, and emotional health. Basically, it has to be done for the minimum of 6 weeks duration, where physical activities will be given in the form of endurance, resistance, and flexible training. Education is an important component of pulmonary rehabilitation. Pulmonary rehabilitation basically has many components. Okay, diet is one of the components, smoking cessation, dealing with anxiety, depression is another component. Okay, specific education about the disease itself and social stigma and more. So now, what happens once the COVID-19 patient is recovered from the ICU? He is recovered from the wards also, he is going back home. Okay, the major complications that are seen in these individuals are fatigue, shortness of breath with activity, difficulty with walking and performing daily tasks, leading to stress, negative impact on mind, fear, depression, impacting the overall quality of life. I personally know many of my friends who have been affected with COVID-19 and now they are having severe fatigue. To such an extent, they say that they can't even walk for one stretch without being breathless. They find it walking as a taxing activity. Even these are the ones who used to climb stairs in order to go to their houses. And now they are like each and every stair they need to take break and then they have to do. Okay, so as we know that the COVID-19 has a bad influence, okay, on all these things, post-COVID rehabilitation is very, very important, and I would like to stress it is a need of the hour, and we need to promote post-COVID rehabilitation. Okay, so now what is the solution for this? As I told earlier, humans are meant to move. So the solution is start moving. Okay, don't think that, okay, I'm getting fatigued. Okay, I just got up from COVID. I need rest. My body needs time to recover. Yes, your body needs time to recover. Yes, which is true. But it doesn't mean that sitting in one place, lying down all the time, you will recover. Because movement heals the body and is a way to restore the mind and soothe emotions. We all know when we exercise, what happens? Happy hormones are being released, right? You feel good. There's a feel good factor that comes out with exercise. So you need to exercise once you are done with your COVID, post-COVID thing. So by engaging the movements the human body is already used to. Don't engage in high-fi activities, okay? Already whatever you used to, like walking, simple activities you can start with. We can begin the process of recovery, healing with exercise and movements. So what are the layers of human movements? These are the three important layers of human movements. That is breathing. Breathing is very important. Without breathing, can we all survive? No. We need to gain endurance. We need to build up our strength. So these are the three important layers of human movements. So breathe deep. So we need to teach our post-COVID patients different breathing exercises that enhances the lung volume, like diaphragmatic breathing, thoracic mobility exercises, and incentive spirometry. Gain endurance by doing aerobic activities, simple aerobic activities. I'm not asking you all to do jumping jacks or going for skiing or the burpees. No. Let's start with simple activities like walking, high knees, stair climbing. These are the activities that can be done. And build your strength. Strength training for the major muscles of upper and lower limbs using dumbbells. If not at home, dumbbells are not available. You can always use water bottles. Now, we have made a video from the Department of Physiotherapy. Well, I would like to say that this is not a complete video. We are making a video for the community, especially for post-COVID patients, based on the WHO guidelines of 2021. The World Health Organization has suggested this. It's support for rehabilitation of self-management after COVID-19 related illness. Now, we will play the video for you all.
Ma'am, you can stop sharing your screen now.
Yes.
Is it visible?
Yes, it is. Okay, as we all know, COVID-19 attacks the body and mind. So our rehabilitation efforts aim to keep you all back on track. So exercising after leaving hospital, these are the benefits, okay? Exercise is an important component of recovery after severe COVID-19 illness. What can exercise do? It can help you to improve fitness, reduce the breathlessness, increase muscle strength, improve balance and coordination, improve your thinking levels, reduce your stress and improve mood, increase confidence and improve your energy levels. These are the benefits of exercise once you start exercising. Now, simple rules how you have to exercise safely as you're dealing with patients here. Always warm up before exercising. Suggest your patient to warm up and cool down after exercising. The patients are asked to wear loose, comfortable clothing and supportive shoes. Wait at least for an hour or after a meal before exercising. Drink plenty of water and avoid exercising in a very hot weather. And you're not supposed to exercise if you're feeling sick or nausea or lightheadedness. Now, once you feel breathless, these are the positions that you can take. You can teach your patient simple position that ease breathlessness, as you'll see. Half sideline position, forward lean sitting position, and forward position with the table, back standing with support, and forward lean standing. These positions are known to relax, ease your breathlessness. Just in case when you're exercising and this positions does not help, and if your saturation is falling down, immediately ask the patient to give a call to their attending doctor regarding the same. And now I will show you all a few exercises. First one is called as a diaphragmatic breathing exercise, where the patient is sitting, placing one hand on the abdomen and the other hand is placed on the upper thorax. Now the patient is asked to take a deep breath through his nose, inhaling as maximum air he can, and then slowly exhale through his mouth. This exercise helps to improve the lung volumes. And this is diaphragmatic breathing exercise. Here you have to see When inhaling, the abdomen should come up. Exhaling, it should move inside. And the next set of exercises, thoracic mobility. The patient is asked to take a deep breath, raising the hand and breathe out, exhale, keeping the hand down. He is asked to repeat all these exercises for 3 sets into 10 repetitions. Breathe in, hands up, breathe out, hands down. The same movement can be done in shoulder abduction. Breathe in, hands up, and breathe out, hands down. These exercises are called as thoracic mobility as they try to improve the mobility of your thorax, thereby enhancing lung volume expansions along with thoracic mobility. You must have seen this instrument. Okay, the next video. Yes, it's called as an in-center spirometry. It works on the principle of sustained maximal inspiration. It has a mouthpiece which needs to be connected to the spirometer device, and the patient needs to hold the device at the eye level and then nicely seal the mouth along with the mouthpiece, and he is asked to take deep breath inhale. He has to inhale as maximum as possible when all the 3 balls that is indicated various lung capacities is raised up. Hold it for 3 to 5 seconds, then slowly exhale it. Inhale, hold the expansion, hold the ball up, and then exhale. Now, once we are done with the breathing exercise, now we are moving on to next set of aerobic exercise. You all know that warm-up is very, very important when we perform aerobic activities. So warm-up should last at least for 5 minutes, and each movement has to be repeated for 2 to 4 times as they are patients. Okay, you can start with the shoulder movements. Shoulder movements back and forth. Shoulder shrugging, shoulder rotations can be given. And backward movement of the shoulder followed by forward movements for warm-up. Each has to be repeated for 2 to 4 times. Once again here. And side bends in order to improve the flexibility before starting the actual aerobic work. And warm up the lower limbs by raising your knees higher. Loosening your ankles with some ankle pump exercises, as well as ankle rotations can be given. Each of these movements repeated for 2 to 4 times only. Moving on to aerobic exercise. The first best aerobic exercise, I told you all initially, even the WHO told that you need to put them back into an activity what they are already doing, what they are already aware of. I told you all, many patients post-COVID, they are finding it difficult to walk. So walking is the best aerobic activity you all can suggest. The goal should be to walk at least for 10 minutes at a pace where they can walk in full sentences without stopping. At least 3 times a day they need to walk for 5 days a week. They can take breaks until they walk for 10 minutes continuously without stopping. And if walking alone is difficult, they can start walking with supportive devices, like we can ask them to use crutches, walking frames, or sticks if needed. Choose a route which is relatively flat, and once you want to progress this walking, then ask them to walk for uphill walking. Okay, progression, increase the speed, distance, and duration. Start with 10, increase 15, 20, and 30 minutes per day, including walking uphill on the road. This is about walking. So apart from walking, you can also ask them to do some high knees exercises. As these patients have just recovered, they want to do the traditional high knee. These are some of the modified knees. And then stair climbing has to be taught to these individuals by keeping a chair next to them in order to ensure safety. And also start with slow progression. Start with maybe you can start with one leg up, and then when you're repeating the movement, use the next leg and increase. Progression is increase the speed of walking as much as they can. Now moving on to strength training, which is important. Strength training can be given to major muscles of upper and lower limb. You can see here the shoulder flexion, elbow flexion, the biceps. It can be done at home if dumbbells are not available with the help of water bottles as well, with 1 liter or half liter, whatever is the patient's capacity. And the same movements for the shoulder, abduction and adduction with the help of weights. This is basically for the upper limbs. And then wall push-ups can be taught. Okay, patients need to do wall push-ups. Maybe just 3 to 5 repetitions you can ask them to do first, and then they can increase. Then for the lower limb muscles, raising up from the chair, sit to stand exercises that works so wholly on your lower limb muscles. And here the progression can be unsupported. Unsupported chair, sit to stand exercises can be done. And leg raising, hold this movement for about 3 to 5 seconds and slowly release it. This is in order to strengthen your quadriceps muscle. These exercises can be given. And moving on to wall squats. These patients might find it very difficult to do the normal squats. So a supported wall squat is what they can start with. Once they are fine with it, then they can start off doing the normal squats. All these strength training exercises has to be done 3 sets into 10. And this is the way you teach them to do heel raises, basically for the calf muscle, strengthening of the calf muscle that is supported. Now, once you're done with all your aerobic and strength training, move on to cool down. We all know that warm up and cool down exercises are very, very important. Cool down should last at least for 5 minutes. Repeat each movement for 2 to 4 times. And you can also repeat the warm up exercises. I'll quickly show you a few cool down exercises what you can suggest for the COVID patients. The first one is, again, shoulder movements along with side bends. Repeat it for 2 to 4 times and stretch for the major muscles of the upper limbs. Shoulder stretches. Lower limb stretching for the TA. For the lower limb muscles. These are the few stretching what we can ask our patients to do. Quadricep stretch supported. Okay. All right. So this is how we can help a COVID-19 patient to get back into their active lifestyle. So if you all observe this video, all these exercises look very simple. You might be thinking that, oh, this is so simple and I'm sure everyone can do. But if you personally ask an experience of an individual who's affected with COVID-19, these exercises are really, really difficult to perform. Okay, so in order to summarize, we saw when physiotherapy reference is given, basically whenever there is a functional impairment limitation that coexists with a respiratory condition or a neuromuscular morbidity along with COVID-19, and then physiotherapy helps to reverse impairments. We saw techniques that improves gaseous exchange, reverse hypoxia, improves lung volumes, improves physical function, builds up strength and endurance. Strict precautions should be taken while delivering physiotherapy, as all the physiotherapy techniques are aerosol generating procedures. Tele rehabilitation is something that can be practiced only when your patient is conscious, oriented and cooperative. Best practice is, along with tele rehabilitation, early mobilization and pruning. And post-COVID pulmonary rehabilitation is the need of the hour, and it has to be done no matter what. So I would definitely recommend post-COVID rehabilitation to all our COVID-affected patients. It will add a lot more to the quality of life. Any question and answers? You can ask me now. Questions?
Thank you, ma'am, for that enlightening session. I'm sure everyone here learned something new today, especially with the video demonstration. Now we will have a well-awaited question answer session. You can post your queries in the chat box and we will convey them to ma'am. So ma'am, we've got a couple of questions for you. The first one, can orthopedic physiotherapy replace the current treatment modality for simple fractures, sprains, etc. in the new normal where going to the hospital should be reserved for emergencies only?
Can you please repeat the question?
Can orthopedic physiotherapy replace the current treatment modality for simple fractures, sprains, etc. in the new normal where going to the hospital should be reserved for emergencies only?
Okay, see, orthopedic physiotherapy is completely a different branch compared to what I'm speaking right now. And yes, see, orthopedic physiotherapy can be given with the help of tele rehabilitation if the patient does not want to come to the hospitals. Basically, we can only give them, we can teach them few exercises, what can be done at home. And pain relieving modality, no, we can only ask the patient maybe to take moist heat or some heat packs or cold packs at home. Otherwise, we use different equipments like ultrasound and IFT and TENS. There are different equipments, pain relieving equipments that are available in the department, which cannot be given virtually, of course. But exercises can be taught, what patients can perform at home, what they can do at home.
Another question was, what is the role of physiotherapy in the management of a COVID patient with asthma?
With asthma. Okay, see, asthma also will have and more many types of impairments, like you have decreased lung volumes and capacities. We can give breathing exercises, as I just showed you all, which improves the lung volumes and capacities. Diaphragmatic breathing can be given. Incentive spirometer can be recommended. Thoracic mobility exercises can be recommended. Okay, these are few techniques. And also, if the patient is post-COVID, definitely I would recommend post-COVID pulmonary rehabilitation with asthma. And pulmonary rehabilitation is individually tailored, okay? So we assess each and every patient's impairments and then give them exercises based on what impairments they are having. It's an individually tailored program. Let me stress on that again.
Thank you, ma'am. The next question is, what were the challenges faced by physiotherapists in both the waves of COVID, and which one was the most difficult to overcome?
Okay, to be very honest, in wave one, the role of physiotherapy was not really, I can say it was not very much. There were evidence that was saying, yeah, physiotherapy has to be given, but we ourselves were not into treating COVID patients, only tele rehabilitation, what we were doing. But in wave two, I feel that all of us are into it. Now we are practically doing whatever we are preaching right now. Okay, and I feel definitely it does make a difference, especially if the patients are not ventilated. And I see a lot of change in when we see patients in the wards. Okay, when we give them start with deep breathing exercises and all these human movements, as I suggested. Okay, making them walk and making them sit, it definitely makes a difference. And even I've heard my colleagues telling, even their consultants were telling that their patients are feeling better. Maybe it adds a bit more to the quality of life. So yeah, wave two, I feel we are more active in treating COVID patients. And wave one, yeah, as everyone says, that it was pretty scary. And we were like, okay, what are the things? It was not clear. Nothing, even the literature was not very clear. What are the do's, what are the don'ts? And even about these aerosol generating procedures, how to tackle this. Nothing was clear in wave one. But wave two is much more clearer, and we know what we have to do and what we don't have to do.
Yes, ma'am. So can percussions be given in acute pneumonia cases, ma'am?
Acute pneumonia patients, I would suggest no. Percussions, it doesn't help, because see, managing pneumonia, no, percussions and vibrations usually doesn't help. Even if you say, forget about COVID, even in general pneumonic patients, it doesn't help. Basically, what helps is your positioning the patient, okay, in whichever area there is consolidation. Keep the bad lung up, try to improve oxygenation to that particular area. That helps, along with early mobilization, definitely helps, rather than giving percussions.
Yes, ma'am.
Percussions usually help when you have patients like bronchiectasis, okay, and you want to really mobilize the secretion and break the mucus pond, yeah, that is the time it helps. Consolidation has to be managed with antibiotics.
Yes. So the final question, are online physiotherapy sessions effective for patients who have suffered stroke and neurological conditions, provided that they are cooperative?
Not really. I wouldn't vouch for it, because these patients require a lot of motivation. They will lack strength, okay, and they require a lot of motivation unless and until the patient, and each and every, see, it starts with grade 1 strength, and there are different techniques that we use. We give electrical stimulation in order to initiate that muscle contraction. So we start from lower to higher techniques. So online for stroke is not something what I would really suggest, provided, no, I really can't comment on this.
Ma'am, so that what is the treatment modality for a patient who suffered stroke and who's having weakness in a
These
particular...
patients will get neuro-rehabilitation.
Okay,
Neuro-rehabilitation is what we recommend for. It doesn't come under cardiorespiratory rehabilitation. And we start with the basic exercises, like if the patient has absolutely zero grade, then passive movements will be given. And then absolutely, if you have to stimulate a muscle contraction, yes, in order to stimulate the nerves, then electrical muscle contractions will be given. And then slowly we train these muscles. It's not like, in day 1, you get results for stroke patients. And early mobilization, of course, we do practice early mobilization for stroke as well.
One more question has come, ma'am. A chronic smoker suffering from COVID, what will be the physiotherapy management?
Chronic smoker suffering from COVID. Okay, the same thing, identify all the impairments. What are the problems he is having? Is he maintaining SpO2 or not? Okay, especially after the 6-minute walk test, how much is the saturation falling? You need to tackle that. As he is a chronic smoker, I would suggest smoking cessation is a must here. Okay, and following that, you need to give breathing exercises that would reverse hypoxia and hypoxemia. Breathing exercises like active cycle breathing technique, diaphragmatic breathing exercises can be given. If secretion retention is there because of the loss of mucociliary activity that has caused due to severe smoking, okay, we suggest airway clearance techniques. He can use a cappella, PEP devices, flutter devices in order to clear his airways.
Thank you, ma'am, for answering all our questions and clarifying our doubts. So before we move on, I would like to welcome our Dean, Dr. Jaiprakash Alva, for joining the platform and for his constant support. As we all know, during these tough times, lots of people have lost their jobs and are struggling to keep up with the expenses of the hospital on top of the household expenses. I think that we should do our due diligence to help out in any way we can. So we have set up a fundraiser to help the underprivileged people who have affected with COVID and undergoing treatment in our hospital. On the screen, we have the QR code, so you guys can take a screenshot or directly scan and pay towards this cause.
The next speaker for today is Dr. Smitha Raskina. Dr. Smitha Raskina, an assistant professor in the Department of Psychiatry, Father Muller Medical College Hospital, is an alumna of St. John's Medical College Hospital, Bangalore, and Father Muller Medical College, Mangalore. Her primary areas of interest include perinatal psychiatry, child and adolescent psychiatry, and simulation-based education. To this end, she has conducted several workshops and delivered guest lectures on themes such as mental health, drug abuse, peer pressure and sexual harassment, etc. She has several publications in reputed academic journals to her credit. Most notably, she has co-authored a paper on wandering behavior in patients with bipolar affective disorder, published in the Galore International Journal of Health Sciences and Research. The various roles and responsibilities that ma'am has undertaken display her keen association with students and their activities. Her career trajectory reflects her multifaceted personality as well as knowledge and experience in psychiatry, making her best suited to deliver today's session on mental health issues faced during the pandemic with the required sensitivity. Over to you, ma'am.
Thank you very much for that lovely introduction. So I'll just share my screen. Good morning, everybody. First and foremost, congratulations on an extremely well-organized, well-thought-out, and empathetic webinar that you guys have been managing over the past 2 weekends. Okay, it makes me very proud to see students take such a strong initiative and carry this out the way you guys did. So kudos. Okay. And also thank you for the organizers for inviting me to talk about this. So when the topic was given to me, that is mental health challenges during the COVID-19 pandemic, it's very vast. It's a vast topic. It's a very layered topic, and I really didn't want to bog you guys down with numbers and statistics. At the same time, I wanted you guys, because you're medical students, your paramedical students, your interns, I wanted you to have the scientific base you need to have to understand this, as well as I wanted to give you practical tips to help you out during this pandemic, because everybody is going through the same thing. Everybody is stressed, everybody is fed up, everybody is bugged, so I wanted to have that balance, and I hope I will be able to do this through this talk. Okay. So moving on. Okay, so COVID-19 doesn't need any introduction. It's infamous. It's a global catastrophe. The numbers speak for itself. Okay. However, from the first wave itself, there has been a lot of talk about what the mental health impact would be. Okay, everybody spoke about how after the COVID wave 1, wave 2, you're going to have a mental health impact wave. Okay, and that wave has actually occurred much earlier, and it's still going on, and it is of great concern. Okay. Just to give you an idea about what the mental illness burden was in India prior to the pandemic. Okay, so this was the National Mental Health Survey conducted by NIMHANS in the years of 2015-2016. 13.7% of the total population was found to have some sort of mental illness. Okay, and now 13.7 may sound like a really small number. It's 13.7. What is the big deal? But when you actually translate that into our population and into numbers, it is 197.3 million people. Okay, with some sort of mental disorder. Okay, to make it to give it more perspective, 1 in 20 people in India suffer from depression. Okay, so you can think of your class of 150 students, 1 in 20 may have suffered or is suffering from depression right now. Sorry, this is a newspaper clip, okay, from the Times of India, just to give you another perspective. Okay, 28% of the global suicides occurred in India. Only 49% had a mental health facility within 20-kilometer radius, and 26% reported no mental health facility within a 50-kilometer radius. This is important because I will talk to you about what the pandemic has done in terms of our patients with mental illness being able to access mental health care. Okay. So obviously, after the pandemic, during the pandemic, you're talking about the mental illness burden, which has greatly increased, both in the general population as well as certain specific populations. Okay? And the greater adverse impact is seen on healthcare workers, including interns and medical students. Okay. So a little bit about the etiopathogenesis. So when we look at psychiatric disorders, we usually talk about the biopsychosocial model. Okay, biological factors. There have been certain biological factors which are especially seen in patients with COVID-19, and that I will talk about when I talk about that particular population. Okay, and we've seen psychosocial factors. We're seeing general issues as well as issues specific to each population that I will talk about. The general psychosocial factors include, COVID-19. This is a new virus. Okay, we knew nothing about it. Now we know something about it, and then something keeps changing every day. Okay. We know that it is highly infective. It can be lethal in cases. Okay, so there's this fear of the unknown. What is this? And uncertainty. What's going to happen? What is happening right now? Is it this? Is this drug better? Is that drug better? Is this treatment better? Is that treatment better? A drug which was hailed as a miracle drug, a few months later is moved out of the guidelines. Okay, so we live right now in an era of unknown and the unknown and with a lot of uncertainty. Social distancing and isolation or quarantining for our good, for the good of everybody around us, but this has also managed a social animal. Okay, so this has brought in a lot of changes. Okay, which has definitely impacted our mental health. Okay, we talk about the lockdown, okay, which again is to contain the spread of the infection, but that also has brought in a lot of stress, a lot of changes, a lot of financial strain for a lot of people. Okay, you're talking about closure of educational institutions. You have schools where kids go, they learn social skills. Learning, apart from education learning, they learn so many other things. They learn social skills, they learn how to work in groups. Okay, they have friends, it's a break from home, and you suddenly have this closure of educational institutes. Kids are back home. Parents find it difficult to manage both working at home and taking care of kids. Students, how it is to not be back in college or not in the hostel, and we'll talk about that more. And stigma. You have a stigma against patients with COVID-19. You have stigma against the relatives of patients who have had COVID-19. You have stigma, unfortunately, against healthcare workers who are dealing with patients with COVID-19. And the stigma stems, a lot of the stigma stems from not knowing what the illness is about, from misinformation, and from fear. So we're in a pandemic. Okay, there's a lot going on. Like I said, you don't know what is happening. You're uncertain about the future. The systems you expected to catch you when you fall are not really working. So a lot of people feel stressed. A lot of people feel anxious. A lot of people feel sad. They feel fearful about what's going to happen, and they are worried. Okay? And a lot of people feel anger at things that should have been working and are not working and are failing them. What I want all of you to remember is that this is normal. It's completely normal to feel these emotions. Okay, we have a range of emotions. We can't always feel happy. We can't always feel safe. We can't always feel glad. Okay, it is normal to feel these emotions, and that you are not alone. Okay, everybody is going through the same thing. Okay. However, if these emotions are in excess and they're pervasive, they're there all the time, and they are there for say 2 weeks or longer, okay, and it is interfering with your functioning, it is interfering with the way you sleep or eat or study or read or interact with others, then that is something that requires help, and we will talk about that as well. Okay. So what are the mental health challenges, okay, in various groups of people? So I will be talking about persons with COVID-19 and caregivers. I will be talking about healthcare workers, talking about our dear interns, okay, medical students, as well as persons with existing chronic mental illness. Okay. So persons with COVID-19. Okay, so what studies have found that persons with COVID-19 have a higher risk of developing a new mental health illness, even if they did not have a mental illness previous to the development of the infection. There is a risk that they may develop a new mental health illness. Okay. So I was talking about the biopsychosocial factors. Coming to the biological factors, these play a major role in patients with COVID-19. However, what exactly is the biological factor right now is yet to be ascertained. So it can either be, we all know that COVID-19 goes and affects, it is possible for the COVID-19 virus to affect the CNS. So is it the direct effect of the virus in the CNS, or is it encephalopathy changes secondary to the massive inflammatory or immune response? Okay, so there have been studies where they've had a range of neuropsychiatric effects in the patient, okay, in forms of say psychosis or delirium. Okay? And when they did a cerebrospinal fluid CSF analysis, what they found is that the virus was not detected. Okay? Okay. So there is no virus, but still you have just these changes. So is this the is this the effect secondary to the massive inflammatory response? Okay. Or is this because of the associated physiological derangements of a critical illness, or cytokines? Or is it the medication that is used to treat it? Okay. So in addition to that, psychosocial factors which come into play in persons with COVID-19 include the financial burden, the sick role, worries about the outcome, what's going to happen to me. Once I go back, I'm in the hospital right now. Once I go back home, is my apartment building association going to let me in? Are they not going to talk to me? Are they not going to talk to my family? Right now, I'm alone in the hospital. No one is allowed in. I'm feeling miserable. Okay, those are the psychosocial factors which may play a role here. So what are the signs, clinical features that you see with persons with COVID-19? Okay, so in the acute stage of the illness, delirium is something that is seen quite commonly. In fact, this is from the journal Nature. Okay, in a typical critically ill patient, okay, maybe 31.8% would have had delirium. Okay. In COVID, the proportion rises to more than half, that is 55%. Okay. Again, biological factors are thought to play more of a role here. Okay. You can see depressive symptoms, you can see anxiety, you can see insomnia. In fact, more than 60% do report insomnia. PTSD. Okay, so PTSD stands for post-traumatic stress disorder. And one thing that has been noted is patients who have had severe hypoxia, okay, severe breathlessness, or who have been intubated and have been on the ventilator tend to report more post-traumatic stress disorder symptoms, okay, because the trauma here, so post-traumatic stress disorder, as the name suggests, is secondary to the trauma, okay, and the trauma here in this case is considered to be the hypoxia or the excess severe breathlessness or the intubation and the ventilator. Okay. Later on, post-COVID, even after they've been infected, say about 4 weeks later, we see certain neurocognitive impairment in the terms of memory problems, attention and concentration problems, problems with processing speed, especially in cases of severe ARDS. Coming to the caregivers of persons with COVID-19. Okay, so psychosocial factors in this case include the burden of caregiving. Okay, that there are various studies on the caregiver burnout, not for COVID-19, on various psychiatric issues, but we know that the burden of caregiving in a case of COVID-19 is quite high. Okay, there's the issue of financial stress, lockdown, job losses, okay, your bills running to, lakhs and lakhs, okay? The uncertainty, what is going to happen. So you have patients getting better, then getting worse, then getting better, then getting worse. So the family is really, on a seesaw. They don't know what's happening. Fear of contamination. So say, God forbid, my relative was in the hospital and they were having COVID. Okay, if I take care of this person, am I going to get COVID? Am I going to pass on COVID to my children? Am I going to pass on COVID to my spouse? Am I going to pass on COVID to my parents? Okay. One thing that has come into picture with caregivers of persons with COVID-19 is grief. Okay, bereavement and grief. Okay, bereavement when somebody passes away, grief just with the amount of loss that is occurring, okay, with patients with COVID-19, loss of life, loss of quality of living. Okay, guilt. Okay, in cases of, I remember I had this patient who was, he was a 65-year-old man, and sadly he did pass away with COVID-19. And I remember his son coming and telling me, I am the person who brought COVID-19 into the house because he was infected first. So he came in and he told me, I'm the one who brought it into the house. It is my fault, So that kind of, which is of course not, true, but the amount of guilt that they feel of, bringing the infection in, a lot of survivor guilt. He passed away. I'm alive. Why am I still alive? Those are issues that we come across. Okay, and these people have a greater risk of developing insomnia, depression, anxiety, and PTSD as well. Okay. Coming to healthcare workers. So one of the most negatively impacted group or population, okay, during the pandemic have been healthcare workers. Multiple studies have been done on this, studies abroad, studies in India. Most of them are survey studies. So the risk factors in this case, I will just enumerate the risk factors, are the long and erratic work hours that the healthcare workers have. PPE. Okay, so PPE, both lack of, okay, where they're scared. Are we going to get the right PPE? Are we going to get PPE when we're seeing these patients? We have to protect ourselves as well as staying in PPE for 8 hours. It's not easy. In conditions which are humid and hot like this, you can't breathe. In my case, my glasses keep fogging up. I can't see. If you need to use the restroom, you can't drink. Sorry, you can't drink water. Poor infrastructure in colleges or in medical setups which have poor infrastructure, not enough infrastructure to support their healthcare workers. Rapidly changing treatment guidelines. Like you guys know, you had the first wave. We said this drug is good, that drug is good. We should do this. We should do that. Then that kept changing. It kept changing every week. And now the second wave, where you say this drug is good, that drug is good, this drug. The change of treatment guidelines from hospital to hospital, from institution to institution, from country to country. Okay. So that is a risk factor as well. A high risk work environment, obviously. Fear of contracting the infection ourselves, as well as the fear of spreading it to our family members, spreading it to our children, our elderly parents. Okay. Being separated from family and friends. So a lot of colleagues and friends that I know have been scared to go back home when they do COVID duties. Okay, so they don't go back home. In fact, they stay elsewhere or they stay in a different department. So that separation itself from family and friends is found to be a risk factor. However, the most important risk factor from all these surveys has been a pre-existing mental illness. So if there is a pre-existing mental illness in a healthcare worker, the chances that there is exacerbation of this pre-existing mental health illness, or you have the development of new mental health illnesses, is quite high. Okay, so this is a little video so I'm guilty of WhatsApp, propagating WhatsApp videos. This is something that we had got on WhatsApp in one of our psychiatry groups to help with doctors with stress. I'd just like to play this video. Please don't sue me. To give you an idea of what healthcare workers and others are feeling during the pandemic in hospitals. Were you guys able to hear that? Was it audible?
No, ma'am, we couldn't hear it.
You couldn't hear it. Okay, let me just try again. And if it doesn't work, we'll move on. Okay. Now?
No, ma'am. We can't hear the audio.
Ma'am, just reshare your screen, and while you're sharing it, just say at the bottom there'll be an option called share sound. Just click that. Share the particular window itself.
Okay, do you guys want me to start this again? I got a message saying that it's not audible, or should we carry on? What do you guys want to do?
Ma'am, you can try playing it again, but
okay,
mute
myself. All right, I'll try that one more time. Sorry.
That's okay.
Oh, ma'am, we couldn't hear the audio now also, ma'am. If you could narrate whatever is being told. You're on mute, ma'am.
Okay, sorry about that. Technology is definitely not my forte. No, it's about the the difficulties they have about patients dying under their care, the amount of burnout they're feeling, the amount of compassion fatigue they're feeling. One doctor talks about how patients are dying and he's feeling numb. Okay, he's not able to react to the patient dying itself. They talk about how they feel there are not enough staff to manage the number of patients they're seeing, about how they miss their family, about how they can't see their kids. So it was that. I'm really sorry about this, but I think we should move on because of the lack of time. Shall I move on then?
Yes, ma'am, sure.
Yeah, okay, all right. So from various studies, the prevalence of anxiety, depression, stress, insomnia in healthcare workers ranged from about 11.4% to a whopping 71.5%. Okay. So what was found in the studies which reported 11.4% is there were a lot of protective factors. Okay, protective factors, especially support from institutions, adequate PPE, adequate infrastructure, support from peer and family members. Okay, and the ones which had the higher amount of anxiety, depression, stress, and insomnia had the risk factors that we spoke about. Okay. Okay, all right. So moving on. Okay, coming to interns. Okay, so I'm guessing there are a lot of interns in this audience. Am I right?
Yes, ma'am. There are a few interns.
There are a few interns. Okay, so internship is an extremely exciting time. It's a new thing. You've cleared your 4th year MBBS exams. Congratulations. You're now an intern. You're a doctor. You want to do so many things, you want to learn so many things, okay? But it is also a scary time because this is the time that you want to pick up skills, okay, that you have to do this under supervision, okay, and you have the added stress of studying for your competitive exams. Okay. So studies have found that it is an inherently stressful period. In fact, pre-pandemic studies have found a high rate of depression, that's 35 to 70%, okay, as well as anxiety, stress, and substance use. Okay. So what is different during the pandemic? Okay, there is a disruption of the normal outpatient services. You have elective surgeries which may get cancelled because of the pandemic. Okay, there may be limited interaction between the intern and the patient. Okay, and this is done just to curb the spread of the infection. But that means limited exposure of the interns to the patients, or the patients to the interns. Sorry, and this may have a detrimental effect on their learning, clinical learning, because let's face it, everything is COVID focused, so they may be wondering, okay, how are we going to learn about other conditions? How are we going to learn? How are we going to manage once we pass out? Okay, are we missing out on something? Okay, and obviously they have all the other risk factors that we discussed in general when you come to healthcare workers: the risk of infecting themselves, the risk of infecting other people. Okay, so we conducted this a little study, and this was a study that was conducted pan-India, and here are certain excerpts from interns. Okay, so there was an open-ended question in the study, and interns from all over India. Okay, you have to remember that this is a very varied group. There are interns from medical colleges, which interns are the first line for COVID management. There, they manage everything, and there are interns who have taken a back seat when it comes to COVID management, because there are other people to take care of COVID management, and they take care of regular patients. So these certain excerpts we've taken from, I think, 700 plus interns. I just put up a few to talk about certain feelings that they have. If I could just request the organizers to unmute. Is Shreya there?
Yes, ma'am, I'm here.
Hi, Shreya. If you could please read out the excerpt. So you could read out one slide, and then I'll ask somebody else, because it'll get boring to just keep hearing my voice. Okay, yeah.
Not at all, but surely, of course. So the first excerpt is, I'm afraid to return home as my parents are asthmatic and hypertensive. I fear for their lives more than me. We have just entered the field. All we need is interaction, care, and support from our senior staff. The next one says, mostly worried about not being able to learn lots of clinical skills, which I could have learned in internship, but had there been no pandemic. How will we go out and treat common illnesses?
Thank you, Shreya. Malin? And this excerpt was, this excerpt that Martin is going to read was quite vocal, and I could feel the amount of distress and frustration this particular intern was feeling. I cut down the excerpt because it was quite long. It would have taken the entire slide. Martin, go ahead, please.
Yes, ma'am. We need more breaks for crying out loud. Have to work in fever clinic, isolation wards, NICU, casualty, screening duty, wearing PPE kit for 8 hours cause UTI. Quarantine was especially lonely. Interns are never considered first for PPE or even a simple mask. Interns who are the first people who come in contact with these patients. Anxiety about PG.
Yeah, thank you, Manin. Robin, could you please unmute Robin? Is Robin there?
Yes, ma'am. Yes, ma'am.
Could you read this, please?
OCD-like symptoms have sparked up in a lot of us due to constant hand washing after touching everything. It's also leading to dry skin and dermatitis-like condition. The constant nagging of seniors and no support of seniors.
Okay, thank you, Robin.
Yes, ma'am.
Yeah, so as you can see from the excerpts, and again, there was more than 700 interns included in this study, but as you can see from the excerpts, okay, more than half, and what we found in the studies, more than half of the interns reported psychological distress. Okay, they're distressed, they're frustrated, and what we also found was that a past history of psychiatric symptoms or illnesses and the lack of support from peers, from seniors, from faculty, those are the two major risk factors for developing this psychological distress. Okay, and in more than 2/3, worries about their education, their current education, their acquirement of clinical skills, as well as their future career was present. Okay, just to note, these excerpts were from the first wave. Okay, fortunately, there is a ray of hope. Most of the interns, and we did ask this question, most of the interns did not regret choosing their career. They were happy that they were doctors. They felt they were doing, something meaningful. Okay, and they were helping people, and they did not regret choosing to become doctors. Right. Okay. Coming to medical students, okay, so, again, most of our audience is medical students, and I don't need to tell you guys what are the risk factors and what are the psychosocial factors we're looking at when it comes to the pandemic and developing psychological distress. Okay, so you have a sudden closure of your college. Okay, you're out of the hostel back home, or if you're for day scholars, you're back home all the time. Okay, you have to suddenly, take up online classes. And kudos to you guys, because, I wouldn't be able to take online classes every day. I am technologically completely, what do I say, backward. Okay, and not only that, for me, I need to read books. It's difficult for me to look at the screen. It's difficult to look for me to look at PDFs and learn from the screen per se. So kudos to you for braving this and managing this. And one thing that we had seen, we as well as a lot of colleagues all over India had seen, is that a lot of students did approach us because they felt less confident when it came to the exam. They felt a lot of distress, and these are students with excellent coping skills who've managed all this while suddenly when exams came, they felt things like, we've never even seen a patient before, we've not touched the patient, we have not palpated the liver, and suddenly we're expected to go for an exam and palpate a liver. We're feeling stressed, we're feeling unprepared for this. Okay, so that is also something that we had seen in students. Okay, if we can go, I think I would like Iman as a volunteer, if somebody could, these are excerpts from a study which colleagues had done. I'm not putting up the this because this is just in the process of publication, it hasn't been published yet. Okay, so if you could just read up this.
I'm a bit tensed. I'm not completely able to follow the online classes because I'm much more used to reading books. Sticking to online classes is bringing so much headache, hence much worried about my academics and feeling so low. I'm worried about my future and career, financial crisis. I feel down, not usually a short-tempered person, but feeling angry and irritated for no reason. Attention span is less, and then comes network issue, especially in rural areas. I feel nauseous that I have nothing of what has been covered through online classes. All notes and study materials being stuck at the hostel, updating is troublesome. The next one says, depression has eaten me.
Thank you. And that really got me, for somebody to feel so hopeless and troubled to actually put a line which, and that was the only line, which said depression has eaten me. All right, Shreya, if you could read these excerpts, please.
Yes, ma'am. I think I worry too much for things that don't necessarily matter. Like, I know it's not very important, but I'm not able to stop worrying. Then there are also days I feel extremely hopeless, but obviously I try to distract myself, but being at home always kind of makes it hard. There are lots of family problems right now I'm dealing with. Daily quarrels with my mother. She always discourages me, puts me down. I want to meet my father and girlfriend.
Yeah, I kind of felt really sad for him. Poor thing, he's missing his father and girlfriend. All right, can you continue, Shreya, please?
Yes, ma'am. Feel like I've attained a state of balance, not too happy, not too sad. A positive change that I've stopped worrying over silly things. Because there's a realization that everyone's equal and same, and I'm not any special than you or vice versa. I am safe at home. Got some time with family, happy about that. Missing college, friends, hostel, practicals. Important thing is I'm becoming part of such an important profession.
Thank you, Shreya. All right. So as you can see from these excerpts, these are certain excerpts that I took out because they're very hopeful. Okay, I mean, there is, the situation is quite bleak. Okay, there is a lot of distress that we see, but there are, certain students who find it easier to be at home. They feel safe. They feel, that they are doing something. They feel that, the things that they usually worry about, I don't know, like say, where are we going to have, are we going to eat at McDonald's or are we going to eat at Pizza Hut today? Or, say, how do I look in my Insta profile? You guys have an Insta profile? I'm not sure. I'm not on Insta. I'm very sorry for sounding like such a noob. Anyway, the point is that, there are certain students who felt that, okay, these are really small things to worry about. And there are much greater, things happening around us. There are people who felt very safe at home. They felt happy that they're able to spend time with their family. And, they felt that they are part of something much bigger, a much bigger, a noble profession and things like that. There are also students who found it very hard to be at home because of various interpersonal issues that they have with their parents. Right. Okay, so those were about COVID-19 patients. We spoke about the caregivers of COVID-19 patients. We spoke about healthcare workers, interns in particular, and medical students. Okay, now coming to the challenges in persons with a pre-existing mental illness. Okay, so what we found, okay, as a psychiatrist and various other colleagues found was, you remember that Times of India, clipping that I showed you. Okay, so very few people do have access to a mental health facility. Okay, and now with the pandemic, okay, they found it. Most of our patients, okay, are of the low socioeconomic status. They found it extremely difficult to come in and meet us to consult. They found it difficult to procure medication. Okay, because all psychiatric medications require a prescription. You can't just go to the pharmacy and get one. Yes, telemedicine is there, telepsychiatry is there, but many of our patients don't even own a smartphone. Okay, forget having a good internet connection. Also the issue was, since most of us are posting COVID duties, we're on rotation duties or whatever it is, the continuity that they had with a particular therapist or particular psychiatrist was not maintained. Okay, so studies have shown that psychiatric patients with psychiatric illness, by virtue of their illness itself and their lack of insight or their delusions, have a higher risk of contracting the illness because they are not able to follow the guidelines, the coughing and sneezing etiquette, wearing a mask, okay, or maintaining social distances. And surprisingly, and this came as a surprise to me while I was reading for this talk, is that they have found that in people with COVID-19, okay, the biggest risk factor for death is old age, okay, and they found surprisingly that the second risk factor is actually a diagnosis of schizophrenia. Okay. So why this occurs is still to be ascertained. Whether it is because there is a theory that schizophrenia can be immune mediated. So does this something that has to do with COVID as well, immune-mediated etiology, or is it because of the co-occurrence of metabolic syndrome along with schizophrenia? So are we talking about other comorbidities, or is it some other pathway that we do not know about? Okay, so the risk of death also is very high in patients with schizophrenia who contract COVID-19. Okay. This is a personal favorite of mine. So you're sitting in the OPD, you have a mask on, we have a mask on, we have the face shield, I have my glasses which continually fog no matter what I do. I've tried everything, I've tried dish soap, I've tried putting tape here, and then we have the screen in front of us, like a plastic screen in front of us, and then you have the patient sitting across with a mask, okay. It is very, very difficult to establish rapport like that, okay, which is essential in psychiatric interviews. Okay, it is very difficult to assess the patient's affect, okay, the patient's mood state. By affect, I mean mood state. It is very difficult to sometimes even hear what a patient would say, severe depression, or a patient who is psychotic and is quite guarded about giving out the symptoms is saying. Okay. It is very, very difficult. There have been times I've just taken the screen in front of me and kept it down, taken off my face shield and say, okay, now please tell me so that I can hear you, because otherwise how are we going to treat this patient? Okay. So we've had difficulties, and these are difficulties all around with patients with an acute psychiatric illness. So acute mania, with lots of manic symptoms, high energy levels, high psychomotor activity, or acute psychosis, agitated patient, violent patient, or patients with any mental health emergency for that matter. It's who have tested positive for COVID-19. It's very difficult to isolate these patients, to keep them in quarantine, to isolate them from other patients. So this is also another difficulty that we've faced. Non-cooperation of patients, again, by virtue of their illness, for the swabs or for the tests that need to be done, your nasal swab, your oropharyngeal swab for COVID. We've also had a lot of difficulties, especially in consultant liaison psychiatry, with pharmacological interactions. So when hydrochloroquine was a big thing, okay, with patients who are, say, in delirium and agitated. So say we had to give haloperidol, which is an antipsychotic, to manage the delirium. We know that haloperidol, there's a risk of most antipsychotics for increasing the QTC interval, okay? hydrochloroquine also increases QTC interval. Azithromycin also increases QTC interval. So where do we balance it? How much do we give? We needed to be careful about that. Benzodiazepines. We had a lot of alcohol dependence syndrome patients coming in delirium tremens who were COVID positive. We had to give benzodiazepines, and since benzodiazepine, there is always a risk of respiratory depression. Okay, how much benzodiazepines can we give with somebody who's already whose respiratory system is already compromised because of COVID-19? Okay, luckily there are guidelines now which have come out which have said that you can give benzodiazepines, okay, as long as you monitor SpO2 regularly and you give the smallest possible dose of benzodiazepine for the shortest possible time. Okay, so those were difficulties also that we faced with patients with mental illness. Okay, and with a lot of wandering mentally ill patients that were brought in, we had absolutely no history. A history about exposure, history about the symptoms of COVID as well. Okay, so I spoke about, what were the kind of symptoms we see, what were the risk factors, what is the etiopathogenesis, what we can spend. Now coming to an important part, which is management. Okay, so I'd like to divide this one. Again, I really thought about how I should talk about this, but what I'd like to do, I'd like to talk about how we can all cope with what we're feeling, general coping strategies, okay, as well as when do we really need to seek professional psychiatric help. Okay, so coming to coping, okay, there just a quick theoretical thing here. There are two types of coping. Okay, there is emotion-focused coping and problem-focused coping. When you talk about emotion-focused coping, it is when you have a range of negative emotions. You have anger, you have sadness, you have worry, and how do you focus just on the emotions? Okay, you need to recognize those emotions. Yes, I am going through this. You need to accept that you're going through these emotions. I'm going through this. It's normal. I'm a human being. I'm going to feel these emotions. And how am I going to cope with these negative emotions? When you talk about problem-focused coping, you have a problem. Say, you have a really annoying neighbor who keeps throwing his garbage right in front of your house. Okay, random example, but anyway. So a problem-focused coping in this, you're feeling angry, you're feeling irritated. Okay, but here you can do problem-focused coping. You can go and talk to the neighbor and tell him, look, I really don't appreciate this. Is really troublesome. Can you please throw it somewhere else? Or you can talk to the building association or whoever it is. You can find a problem. Find a solution to that problem, and that is your problem-focused coping skills. Okay, emotion-focused coping skills are done in cases where things are out of your control. So now I'm going to talk to you about things that you can control versus things that you can't control. Okay, so this is a circle. Okay, these are the inner circle is the circle of influence, that is things that you can control, and this is the circle of concerns, things outside my control, things that I have absolutely no control. And I find that this is a very important distinction that we need to make, especially during these times. Okay, so what are the things that you can control? Okay, you can control, your etiquette and the following of the guidelines that are required during this pandemic, social distancing, hand washing. You can control things like, noticing the positive things that are happening around you. Okay, I will come to positive thinking because there is a huge debate on that, but I will come to that. Limiting social media and news intake. Okay, see, it is very important to be informed. It is important not to be ignorant about what is happening. But if you are going to expose yourself to sensationalist headlines with loud anchors and ta-da, 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 going out on the screen with traumatic images, okay, it's not helping anybody. Okay, so get your news, okay, get your information from reliable sources, non-sensationalist sources, and probably limit the amount you need to have. Just get enough news to be informed. Okay, so sometimes I tell people, you can check the headlines in the morning and you can check the headlines say before dinner. Okay, and that's it. Don't follow WhatsApp messages or WhatsApp news forwards and misinformation like that. Okay, finding new ways to stay in touch. Okay, again, like I said, man is a social animal. It is really difficult to be isolated at the moment, but we have technology. As much as I'm bad with technology, we have technology. We can video call, we can do webinars like this, and we can stay in touch. Okay, find out new ways. A friend of mine has a 9-year-old son who the other day managed to get us all into a virtual game of hangman. He got his parents, he got a few of his parents' friends, he got his cousins, and all of us had to play hangman with him. He's 9, okay, by the way, through a virtual platform. Okay, so stay in touch like that. Learn new skills. Rediscover your hobbies. Okay, rediscover. Like I've been doing a lot of reading during the pandemic. You know, I've got books that I've really wanted to read. Rediscover your old hobbies. Try to find new hobbies. Okay, with the limited resources that you have. Okay, helping others. Okay, so. You know, we talk a lot about compassion and how it is good to help others and be kind to others, and you know, like this that you guys are doing. Okay, you know, I'm very proud of you. You know, for this thing about, you know, collecting money for poor patients. Okay, so things like this. Okay, so they say it helps other people, but remember that it helps you. Okay, it gives you a sense of purpose. It helps you manage your emotions. It makes you feel good. So there's a selfish motive also. With helping others. Okay, so learn to do that. So these are things that you can control. These are things that you can change. Okay, so this is your problem focused coping. Okay. Things that you cannot control. Okay, that are out of your hands. Okay, there's no point worrying about it because you can't really control it. Okay, so how long will this last? I don't know. The politics, you know, you can't, unless you become a politician yourself, you really can't help this. The economy, okay, the death rate, the lack of PPE, the ventilators, things that you cannot control. This is where your emotion focused coping skills come into play. Okay, now a word about positive thinking, because there's a lot of, you know, everybody should be positive and you should be positive. See, we're human beings. Okay, we need to have empathy. Okay, we need to know what is happening around us. Okay, there is a lot of suffering happening around us. There is a lot of death happening around us. Okay, we need to recognize that. You cannot avoid that. You cannot say no, everything is fine, the world is a beautiful place, we're all getting along very well. No, it doesn't work like that. Okay, you cannot excessively avoid what is happening. Okay, at the same time, okay, you cannot think of the worst case scenario. Okay, like definitely I got COVID means I'm going to die only. There is no option, there is no other option. Okay, that is called the worst case scenario. Okay, best case scenario is like everything's fine, I got COVID, what is the big deal? Okay, you need to find a middle ground, a place between the worst case scenario and the best case scenario. Okay, so when we talk about positive thinking, it is finding the middle ground. It is not avoiding what is happening around you. It is not being ignorant about what is happening around you. Right. Okay, so how to cope? The basics. Eat well. Okay, and when I mean eat well, I mean eat healthy, eat at regular intervals. Okay, make sure you don't, you know, do a lot of junk food eating, a lot of chips, a lot of cola and things like that. You know, sleep well, sleep for the recommended 7 to 8 hours, sleep at the same time every day, wake up at the same time every day, get your sleep cycle in, you know, in tune, try to avoid long naps during the day. Okay, and exercise. Okay, like so you had an entire session on the importance of exercise in COVID patients, you know, by Cherishma ma'am. Exercise is very, very important. It is one of the most natural mood boosters that you have. Okay, it keeps you both physically healthy as well as mentally healthy. If you could exercise, sorry, am I audible?
Yes, ma'am, you're audible.
Yeah, sorry. So if you could exercise doing something that you love, you know, say dancing or playing with your pet and running or taking your pet for a walk, you know, on the terrace, okay, that would be great. Yeah. Sorry, I just seem to be having an issue. All right, stick to a routine. Okay, I know that most of you are at home and you know, some people are working from home and it's difficult, but pretend that you had to go to work. Wake up at the same time, wake up at 6:30, 7, whatever the time is, you know, take your morning shower at the same time, breakfast at the same time. Okay, start working in a specific area designated for work. Okay, so that, you know, you are emulating a work environment at home. Okay, so stick to a routine, connect with others. Like I said, you know, more activities online like this, rediscover your hobbies and take a break from the news. Okay, so this is taken from an article which was published, Caraton, in 2020. Hobbies like music, reading. Okay, online courses. A lot of my friends have come up with all sorts of online courses and have, you know, learned Spanish and origami and various things. Okay, online. Indoor playing, relaxation exercises. I'll teach you a particular relaxation exercise in the next slide. Yoga, meditation. If you do yoga and meditation, good for you. Please continue that. Okay, but remember that no exercise is the be all end all. Okay, any form of exercise, okay, will help you with your physical and mental health at the moment. Okay, right. This is a relaxation exercise that we can practice. Okay, it's called belly breathing. Organizers, do I have time to just go through this quickly with the audience?
Yes, ma'am. Let's.
Yeah, all right. Okay. So I want you, okay, it may be difficult for you to lie down at the moment, but I want you guys to sit, relax your entire body. Okay. Place your hand on your stomach. Okay, you can place your hand on your stomach with me. So usually when we breathe in, we tend to take our stomach in. What I want you to do here is breathe in through your nose or your mouth, whichever you find comfortable. Take a deep breath in and push your tummy out. Okay, take for as long as you can. Okay. Hold your breath for some time, okay, a few seconds, and then exhale through your mouth, okay, as if you are trying to exhale through a straw. So it's something like this. And when you exhale, pull your tummy back in. So inhale, push your tummy out, exhale, pull your tummy back in. Okay, and this is relaxation exercise. It works on the vagus, okay, which is related to the parasympathetic system, and that is the theory behind it anyway. You can practice this few times a day. Okay, it really helps for a few minutes. There are various YouTube videos. You can check YouTube videos from reliable sites and get an idea of how to do this. Right? Okay. So, like I said, see, feeling guilt, okay, that people are dying around us. Okay, we are, we're still alive, we're surviving. Relatives have died. Why are we still okay? And feeling anger at what is happening around us. If and when there are mismanagements, or anger at a higher power. All this is normal. Okay, it is normal to feel this way. Okay. The only problem is anger is a very destructive emotion. It's a very, it will eat you from the inside. Okay, so you need to learn how to channel. First and foremost, recognize that you're feeling this, accept these emotions, and learn to channel it into something, helpful. Okay, something which will help others. There are lots of NGOs. There are lots of, causes that can help during this time. Okay, for example, donating to this, or even holding a webinar like this. Okay. Right, so that would help manage the guilt and anger. Okay, concentration difficulties. A lot of students have come up saying that they really can't concentrate at home. It's difficult to study at home. Okay, finding a certain corner or a certain niche. Okay, that this is your study area. Okay, there are no distractions here. Should not be your bed. Okay, your bed is just for sleeping. Okay, should find an area which is just for you to study. Okay, and see, this lack of concentration, this is a extraordinary situation. Okay, and this is a normal way for your brain to react to this. Okay, so the first thing is stop wondering why. Stop worrying. Why am I not able to concentrate? Why am I not able to concentrate? I could concentrate all this time. Why now? Why now? Why now? Stop wondering why. Stop worrying. Why can't you concentrate? Okay, learn to break your task into shorter chunks. So if you are somebody who could study for an hour and a half earlier, okay, and you can't now, break it into 15 minutes. Study for 15 minutes, take a 5-minute interval. Study for 15 minutes, take a 5-minute interval. It's an individual thing. All of you need to find your rhythm there. Okay. The breaks should not involve anything that requires concentration. Okay. Breaks could be going into the kitchen and trying to cook something, talking to your siblings, playing with your pet. Okay. Something, to distract yourself, going and standing in your balcony and looking at the view, something like that. Okay. And exercise. Again, exercise is one of the most effective ways, okay, to help with concentration as well. Okay, so now these are general ways of coping for all of us, coming specifically to healthcare workers. Okay, so it is important. When you're traveling by an airplane and they give you these safety precautions. Okay, as cliched as this sounds, when they talk about safety precautions, they talk about put your own mask first and then put the mask of somebody next to you, a child or whatever. You need to take care of yourself first. Okay, unless you take care of yourself, you cannot take care of other people. Okay, so check in with yourself regularly. Make sure that what you're feeling. Anticipate that you're going to feel angry or distressed or stressed or worried. Okay, and make an action plan on how you're going to deal with it. Okay, meet the basic needs: eat, sleep, exercise, and take breaks. Okay, connect and communicate constructively. Okay, make sure that peer connections. Again, like I told you, one of the protective factors in various studies found, for individuals, healthcare workers, was connecting with your peers, talking to other people about what's happening, what you're feeling, about the patients that for medicine residents and a lot of people who have been losing a lot of patients to COVID, we advise group sessions, where they come together and they ventilate and they talk about what is happening, okay? But respect differences, okay? Realize that there are some people like me who, when I, if something happens, I would like to go and tell everybody, oh, this happened, I'm feeling so bad about it. There are some people who would like to take some time alone, who would like to think about what happened, introspect by themselves, okay, deal with it in their own way, playing a video game, listening to music, whatever it is, and then come and talk about it, okay? So respect these differences in various people. Stay updated while still limiting media exposure. Have regular check-ins with yourself. Keep checking, okay, are you, what am I feeling? Is this okay to feel this way? Anticipate and address stress reactions, okay? And remember to take care of yourselves first, okay? And remember, healthcare workers, you're doing a noble, wonderful service. You are helping so many people, okay? In whatever little way. You may not directly be involved in managing COVID patients, but in whatever little way you are contributing to the greater good, okay? And remember that, you're wonderful, okay? So you need to honor your service. You need to recognize your part in this. How not to cope. Unhealthy coping habits are using too much alcohol, okay, smoking a lot of weed to manage your emotions, using drugs, okay. This can not only worsen your mental health, it can also worsen your physical health, as well as decrease immunity, where, we really need our immunity to be strong to manage this illness, okay. Excessive avoidance, like I talked, to you earlier, everything is fine, nothing wrong is happening, okay, because if you're going to avoid things like this, if you're just going to push everything under the carpet, one day it's just going to blow up in your faces, okay. So learn to recognize that what you're feeling is normal, these emotions are normal, and learn how to deal with these emotions, okay. Excessive anything actually is bad. Excess sleeping, excess eating, anything like that to cope with emotions is bad. Eat when you're hungry, okay. Do not eat to cope with, you feeling sad or you feeling angry. Okay, so when to seek help? When do you seek professional help? Certain warning signs. If there is a pervasive mood or behavior change, that is something which psychiatrists usually say 2 weeks or longer. Okay, it is there all the time, and whatever you do, things are not getting better. You feel, there is a sudden decline in your academics. You're just not able to study, or you're not able to concentrate. You don't feel like talking to anybody. You don't feel like talking to your parents. Don't feel like talking to your friends, and this is pervasive. Or if there's any pervasive sleep and appetite disturbances. Okay. Remember that when this starts, don't brush it aside thinking, it'll get better. Keep track of what you're feeling, keep track of how you're behaving, keep track of what your friends are feeling, your family members are feeling, and how they're behaving. And if it is excessive, it is interfering with your functioning, or it goes beyond those 2 weeks, okay, please seek help, okay. These are red flag signs that if it is there, we say don't wait, for the 2 weeks or whatever, get in touch with somebody. So you have severe appetite, somebody who's not eating at all day, or is not able to sleep for, for days, 2-3 days continuously. You have severe impairment in functioning, that is your daily work, your interaction, uncontrolled substance use, somebody who's drinking all the time, smoking up all the time, using any drugs all the time, okay. Any death wishes, and I can't stress this enough, okay, anything that I don't want to live it, I feel like jumping off the roof, I feel like cutting myself, I feel like consuming some sort of thing to die, there's no point of living, I'm feeling very hopeless, there is no point of going on, okay. Those are times where you have to seek help. Please seek help immediately, or if you have somebody who's confided in you that these are things, please encourage them to seek help, support them when they go to seek help, okay. Or if you find somebody who is getting paranoid, getting very suspicious of things, or is hearing voices, hallucinating, those are the red flag signs. Okay, it's just a treatment protocol, distress related to COVID-19. Okay, so if you have the mild or intermittent distress, like how we discussed earlier, okay, reassurance will help. Reassurance from family members, friends, reassurance from yourself, reassurance from a mental health worker, strengthening social support, get in touch with your friends. In fact, for the past few days, I've been really, it's been getting to me, what's been happening around, the amount of, the violence, the hate, all of that, okay. Strengthening social support, called up a few friends, spoke to them, ventilated, felt much better, okay. This works for some people, but remember that we are social animals, okay? It is important to have a good social network, okay. Relaxation, like those relaxation breathing exercises that I taught you, or anything, stretches itself can relax you, and lifestyle modifications, eat well, sleep well, exercise. Okay. However, if it is moderate or severe and it is persistent, please consult a mental health professional, okay. And what we will do is we will assess you, Okay, and depending on our assessment, okay, we will either go in for a pharmacological intervention, okay, and pharmacological intervention will depend upon what the symptoms are. So, for example, if it is depression and anxiety, we will look at an antidepressant. We can look at SSRI, for example, escitalopram, sertraline, fluoxetine. Okay, if it is insomnia, we will think of a short-term benzodiazepine use just to get the sleep cycle in place. If it is psychosis, okay, you think of an antipsychotic, whether it's risperidone or olanzapine or whatever it is at that point of time. Psychological interventions, including supportive psychotherapy, teaching you relaxation exercises, CBT, cognitive behavioral therapy, teaching you how to restructure the thoughts, the negative automatic thoughts that you have, okay, and a combination of both. Sometimes, mostly we recommend having a combination of both pharmacological and psychological intervention, depending on what the diagnosis is and what the illness is. Right. I thought a few helplines would be, helpful. This is the NIMANS helpline, the first one. This is our department, that is the Department of Psychiatry helpline. Okay, you can call these helplines anytime that you're feeling like this is too much to deal with, or you're feeling these pervasive mood changes or pervasive distress, and you need help. You can contact these. These websites that I found, okay, are the Sangat is like an NGO, but it has a resource list of various reliable sites that you can go to for various problems. I recommend you check it out. Manvela is a site by young people about mental health issues that they've had and how they try to beat the stigma. Okay, and some of those stories are inspiring. Okay, so I would request you to check it out. Yeah, so I'm done with my talk. Does anybody have any questions? Thank you.
Thank you so much, ma'am, for your insights on such an important topic, facet of this battle against COVID. Yeah, we have a lot of questions that have come away. So the first question is, what measures would you suggest to queer individuals and others who might be living in a very difficult environment at their home to survive this lockdown?
Okay. This is a very important question, okay, and it's a very difficult situation, okay, because you said queer individuals, right?
Yes, ma'am.
Yeah. Okay. So it is, it is the whole process of accepting, okay, what you are, and then talking about it, okay, to family members, okay, in our current society and our current mindset is, as it is, extremely difficult, okay. It requires a lot of sensitivity, it requires a lot of empathy, and you're doing this during a pandemic where it's difficult to have help, okay, is also a very difficult situation, okay. For now, okay, what I would suggest is, first, take care of yourselves, okay, like I spoke about all the coping, about taking care of yourselves. You need to take care of yourselves first, okay. About the reactions that you get, the advice that I would give would depend on the reactions that are coming from the people at home, okay, and the advice would vary depending on what the reaction is, okay. One thing I want you to remember, okay, there is nothing wrong with you, as much as your family members would be saying all sorts of extremely hurtful things. Taking it from their perspective, this is something new. They are worried about what people will say. They are not able to accept it, and the stress of the entire pandemic is also going on. Okay, if you guys require help about certain reactions and you really want to talk about it, you can always contact any of us from the psychiatric department. Okay, we are more than welcome to help you with this. For now, hang in there. I know things are difficult. Please take care of yourselves. Okay, and things will get better.
Thank you, ma'am. So the next question is, how has the pandemic affected mental health of people with other diseases who cannot get consultation or hospital bed, as most of them are reserved only for COVID now?
Yeah, the situation is grim. It was more grim during the first wave. This is a personal experience. I'll have to read studies to get a extremely unbiased view, but it was grim during the first wave. We lost a lot of people due to non-COVID diseases, okay, and the situation is difficult, okay, for them to come out, because first of all they might be compromised medically because of their issues, so they're scared to come out to get help for those issues. They're scared that they might contract COVID, okay, and when they do come to hospitals, they realize that most of the hospitals the focus is solely on COVID. Luckily, we still have our OPDs running. We are still looking at other patients. Okay, so yes, it has taken a mental health toll. A lot of patients have developed depressive symptoms, anxiety symptoms. A lot of patients have succumbed to the illnesses that they have, and a lot of family members have developed, a lot of distress. Okay, because of this. Okay. What the solution is something which is out of the scope of this talk. Okay, this is a solution which comes in, would have to come from multiple sources, multiple layers. Okay, I hope that answers your question.
Yes, ma'am. So the next question is, disease acceptance in patients already suffering from depression or mania or suicidal tendencies, how to handle it regarding counseling and mental well-being? Will such patients need hospital care even with mild symptoms?
I didn't quite get the question. So you're talking about people with mental illness, okay? And after, yeah.
So how to handle it regarding counseling and their mental well-being? Will such patients need hospital care even with mild symptoms?
Mild symptoms of the mental illness, you're saying?
Yes,
mental illness. Okay, so hospitalization, admission. Okay, those decisions need to be taken depending upon the severity of the illness. Okay, so if this can be best assessed by a mental health worker. Okay, so if you have somebody who's having mild depression or even moderate depression, with no active suicidal ideation. Okay, with who's still eating well and sleeping okay, you can still manage this patient on an OPD basis or in times like this on teleconsultation. Okay, but if you have somebody with active suicidal ideation, okay, who has already attempted a self-harm attempt, or somebody who's not eating, not speaking, not sleeping, or in catatonia or something like that, or who is at the risk of harming other people or the risk of harming themselves, please bring them in immediately. They require admission.
Yes, ma'am. Next question. How to balance professional and family life, especially when the kids are at home and outdoor activities are almost none. The children are becoming slightly withdrawn and gadget dependent. Any views on that?
Okay. All right. So this is a very good question. Okay. So something about gadgets that I would like to talk about first, and then I'll get to the answer. Okay. So see, kids these days, they are dependent. I wouldn't say dependent, but school is happening online. Okay, what do you expect them to do? They have to, attend to school online, and a lot of things, a lot of their cartoons and this and that is on Netflix. They take somebody's iPad or whatever, the phone, and they have to look at it. Okay, so there are various factors here. Okay, but what we need to remember is the number of hours that the kids spend, okay, on the gadgets is important. Okay, so that needs to be limited in terms of, you can't just say, okay, you just do schoolwork online and nothing else online. Okay, that's not fair on the kid. So probably schoolwork, these many number of hours, entertainment and recreation, these many number of hours. Okay. Apart from that, what is important is the amount of quality, the quality time spent, the quality of the time spent with these kids. Okay, I understand that it's difficult for parents to spend a lot of time because you need to cook, you need to work, you need to clean the house, and those dishes are always piling up in the sink. Okay, personal experience here. So how, it's difficult to spend that much amount of time with the kids, but at least the time that you do spend, and you have to spend some time every day, in phases with the kids, the time that you do spend, it is only the kid. The entire focus is the interaction with your child. Okay, it is the quality of the time spent is important in this case. Also, get the children to do things that do not require gadgets, get them to exercise indoors. Okay, I had a friend of mine who actually went to the terrace and drew with chalk a kind of jungle gym for them, like an obstacle course for the kids. Okay, there are kids, kids who develop hobbies of reading during this time, or kids who develop hobbies of indoor games. Okay, it is difficult. It is especially difficult. So studies, these are, again, I'm quoting from studies. They found that women who have to manage work from home and children seem to be more distressed than men who have to do that. Okay, because all the responsibilities come with them. So supporting these women, especially supporting both parents during this time, is important. Okay, usually kids would be managed by other family members, but now because of the risk of infection, that also is not an avenue for them. Okay, there is a wonderful talk by Dr. Shreyoshi Ghosh from NIMHANS, okay, on how to manage kids during the pandemic. I think it is available on YouTube. I will check and I will get back to you guys. That is a wonderful talk, and she gives a lot of insight into how to manage, this work-life balance with kids during the pandemic.
Yes. So the next question is, how is chronic alcoholism being treated in the lockdown, and how has the resuming of sale of alcohol helped or hindered the treatment?
Okay, so do you remember when we had the lockdown the first time, and then suddenly they closed all alcohol shops? Okay, most of the ICU beds at that time were filled with complicated withdrawal patients, okay, patients in delirium tremens, patients with thrown seizures. Okay, so so you can get an idea from that. Okay, so the treatment of ADS patients has followed like how it has always been going on, depending on whether it's complicated or uncomplicated withdrawal. So when you have uncomplicated withdrawal, we usually manage them on an OPD basis unless they want admission. Complicated withdrawal, always admit. We manage with benzodiazepines. Again, I told you the worry about benzodiazepines in this, but newer guidelines state that it's okay, you can go ahead and give benzodiazepines. Okay. About the resale of alcohol, I'll have to do a little more reading about it, but as of we have seen an increase in the number of new substance use disorders. Okay, again, like I said, mostly as a way to cope with negative emotions. Okay, so that is something, that is a trend that we have seen. But other than that, I'll probably do more reading about what's happening in the whole of India and get back to you. Okay, so this is from a personal point of view.
Thank you, ma'am.
You're welcome.
So there's a question from a student. NEET PG exam has been postponed since 1.5 years. And how can students cope up with so much pressure to study and maintain their mental health?
I am really sorry this is happening to you. I cannot even begin to imagine how distressing this must be to you. Okay, but remember when I spoke to you about the circle of things that you can control and the circle of things that you can't control, this is something which is unfortunately out of our control. You've done your best, you've raised your voices, you've raised your concerns. Student associations have written to the concerned authorities. Okay, but right now it is not in your hands. Okay, and we need to focus on things that we can control. Okay, and the things that I discussed with you, how you will have to have a mix of emotional and problem-focused coping right now, but problem-focused coping is kind of out of our hands at the moment. Okay, so we need to focus on the emotion-focused coping. Okay, and I hope that this talk we discussed various coping measures that does help you. I understand that trying to be motivated and trying to study continuously now when you don't know when your exam is very difficult. Okay. Please remember, it's okay to take breaks. It's okay to take some time for yourself. It's okay to chill out. Okay, be kind to yourself. Okay, get back to studying when you are able to. You don't need to do it. Don't feel guilty about taking breaks. Okay.
Yes. So we have one last question now. So what are the roles and responsibilities of the stakeholders, especially patient and administration, towards mental well-being of healthcare workers?
I'm sorry, can you repeat the question again?
What are the roles and responsibilities of the stakeholders, especially patient and administration, towards mental well-being of healthcare workers?
Okay, what patients are we talking about? Are we talking about COVID patients? Are we talking about mentally ill patients? Or?
Mentally ill patients. So what steps can the college or the administration do for such people?
Okay. See, I'm not sure about the question about what responsibilities does a patient have towards taking care of the mental health of the doctor. But when you come to institutions and things like that, higher authorities, okay. So it is important, okay, for you remember the study I spoke, the studies I spoke about where the protective factors for the mental health of healthcare workers. The protective factors is one of the protective factors is support from higher authorities. Okay, so it is institutes or hospitals which had the support of the higher authorities, who let their employees or their healthcare workers voice their concerns, they validated their concerns, and they helped together solve the problem or solve the concerns. Okay, those were protective factors towards the healthcare workers. Having regular information sessions on what is happening with COVID, what are the guidelines, what are our protocols, putting protocols in place, provision of proper PPEs, okay, training sessions, online training sessions of the healthcare workers, how they can protect themselves. Training sessions on mental health of healthcare workers, getting experts to talk about how they can take care of their mental health, or having group sessions of people working in wards where patients are just dying, and helping them overcome the grief and the compassion fatigue. Okay, those are things I think that if the institutions or the higher authorities put in place, will definitely help protect our mental health care workers in terms of their mental health. Sorry, their healthcare workers in terms of their mental health.
Yes, ma'am. Thank you so much for answering all our questions. We're indebted to you for spending your time with us today.
Thank you. It was my pleasure.
Once again, I would like to remind all of you that this is a fundraiser and even the smallest donation can make a difference. Just scan the QR code on the screen and pay with any BHIM UPI enabled app. With this, we have come to the end of this 4-day workshop, which has been spread over the span of 2 weekends. I would like to once again thank both Ms. Cherishma and Dr. Smitha for carving out time, especially on a Sunday, to help give all of us insights on their specialties. Hope you all enjoyed this as much as we enjoyed putting it up. And I can say for a fact that it was a major learning curve for me. Before we sign off, I would like to invite Dr. Ganesh, who's an associate professor in the Department of Gastrosurgery and the president of the Father Muller Alumni Association, to deliver the vote of thanks.
Am I audible?
Yes.
Yes, yeah, thank you. Good afternoon. I'm Dr. Ganesh. We have come to the end of the program. It's a vote of thanks. This COVID-19 has havoked our health system for almost a year now, and it is continuing to do so. So at this outset, I would like to thank our healthcare workers, the effort taken by our institutions, the government, local bodies to contain the disease, and we have attained it to a reasonable extent now. At this point, it's very important to thank our students in association with our Alumni Association. They have done this fundraising program to help out the poor patients who are at need in our hospital. Any program cannot be successful unless the speakers take effort to give a good talk. So I thank our speakers for their time and effort. Dr. Sudhir Prabhu, Dr. Veena, Sister Neha, Dr. Balakrishna, Dr. Vinay, Cherishma, Dr. Smitha, for their time and effort. To conduct a program well, a lot of background work is required, which was done mainly by our 2008 batch Prometheans. So I'd like to thank for their effort Mr. Aaron, Malisha, Raghav, and a lot of other names like Mansa, Samruddhi, Gaurav. I know few of them by person, very few of them. Thanks for their effort to make this program happen. If I've left out any names, I'm sorry for that. Thanks for all those guys who have put their efforts. Dr. Nagesh, who is the head of the Department of Forensic Medicine, who is a course coordinator for their batch, thanks for his efforts to make this program happen. More than anything, Dr. Nicole, who is a secretary of Father Muller's Medical College Association. She's been taking a lot of efforts to conduct such programs on a regular interval in association with other departments and students, etc. So keeping the association active. I thank her for her good efforts to make this program a great success one. Unless there is a generous support from the management, it is not possible for such a program to happen successfully. So I thank for the good help and aid from the management, for the director, Father Richard Coelho, our dean, Dr. J.P. Alva, for the administrator, for the Ajit of Medical College, for their help and aid to make this program happen. And more than that, I could see almost 140 participants at the end of the session, even at the vote of thanks, which is very unusual to happen. I thank for their participation in the program. Unless there are a good amount of participants, the speakers don't feel good for the efforts what they have put. Thanks for being there. Thank you. You're not audible, Mansa.
Yeah, thank you so much, sir. Our sincere gratitude to the Father Muller Medical College Alumni Association for joining hands with us in organizing this 4-day workshop. Dr. Nicole Pereira, the Associate Professor in the Department of Pharmacology at Father Muller Medical College, who is also the Member Secretary of the Alumni Association, has helped us in each step since the very inception of this idea. So we cannot thank you enough, ma'am, for your guidance and assistance. I would also like to thank the management for all the support, and we place in record our gratitude to Dr. Nagesh, Head of Department Forensic Medicine, for being instrumental in organizing this workshop. And thank you to each participant who has joined us in all these sessions. We hope that it was worthwhile for you all. Finally, no amount of thank you is ever enough for the amount of work that the class representatives of batch of 2018 have done, Melisha, Aaron, and Raghav, to piece together every detail of this workshop. Thank you, one and all. The attendance link has been put up in the chat box. Kindly fill the same and mark your attendance for this session. All those who have attended this workshop on all 4 days will be getting an e-certificate. Further details of the same will be notified. Thank you. Thank you, one and all, and have a great day.